Hello and welcome to today's session. We've been looking at blood loss, and in previous sessions we've looked at how to control a bleed, how to deal with an embedded object, and we've considered shock. In today's session we're going to have a specific look at some different kinds of wounds and how we would do those bandaging. So we're going to have a look at an injury to the hand, we're also going to look at an injury to the head and think about our crush injuries. So let's start and see how we deal with a hand injury.
We take a look at the injury to the hand and see that there is a cut going across the hand. We ask our casualty to put pressure onto the wound to control the bleeding, which allows us to go off and get our first aid kit and now to put on our gloves. This provides protection to the casualty and to ourselves from any cross-contamination. We're getting an ambulance dressing and unravelling the ambulance dressing to the pad and placing the pad into their hand and asking them to make a fist. We then take the bandage, going from the fingers around the thumb for 2 turns, covering the knuckles completely to hold the knuckles closed, and then we change direction, going from the little finger over to the thumb, going in between the thumb and fingers. We keep using the bandage, going around from small finger to fingers and thumb, so that we are now firmly tying and giving pressure. When the bandage runs out, we take the short end the opposite way, coming up between the thumb and fingers, and tie off on top, adding to the pressure and ensuring that the fingers keep the pressure on the wound. We then take the ends and just tuck in on top. We now need to think about putting it in an elevation sling, so we're asking the casualty to hold their arm across their chest, and we get out the triangular bandage. We want the length of the triangular bandage to go down the casualty, and the point has gone to elbow. We only need a little bit to tie off in the shoulder. All the spare bandage goes down to the elbow. We take the triangular bandage up around the back of the casualty, and we ensure that it is tucked in underneath the arm so the arm doesn't slide through. We tie off in the shoulder, ensuring that it's providing support and checking with the casualty that it's supporting, because otherwise when they relax we'll find it's not holding the arm. We then take the excess bandage, in this case with no safety pins, we're twisting the ends round and we're tucking in. We now go up to check that we haven't affected the circulation, squeezing the thumb for 5 seconds and releasing for 2 to ensure circulation returns.
Okay, so we've had a look at the hand bandage. You might be thinking it's a bit complicated, but actually if you follow those simple steps it's okay, and with practice you'll get the hang of it and it'll be easy enough and you'll be able to apply no problem. But the key thing to remember with any bandage is you want to just get pressure on. Doesn't matter how tidy it looks, get that pressure on, control the bleed, and you'll be looking after your casualty. So now let's take a look at a head injury.
We take a look at the injury to the casualty's head to see how severe it is. We ask them to put their hands back to keep pressure on the wound while we get a dressing out of the first aid kit. In this case we're using a triangular bandage to cover the wound and absorb the blood, as there's often a lot of bleeding from the head. We then have time to put on our gloves to provide us with protection as well as the casualty from cross-infection. We could then use an ambulance dressing to apply pressure, or in this case we're going to use a crepe bandage, as you often get more length and get to apply better pressure to the head wound. So we're putting around the first 2 turns around the head to anchor the bandage in place. We're going at the front of the head and to the back down by the neck. The key tip with doing head dressings is to keep the bandage low around the back of the neck to anchor it in place and stop it slipping off with the hair. We've now taken the second bandage and we've anchored it in at the back, and we've brought it to the front, and we're now turned the bandage over the top and then change direction. We go to the back of the dressing and then put it underneath the bandage that's coming around. We keep repeating this process, covering the whole head with bandage, so you can see there again that the bandage going for the top has gone underneath the bandage going around. By using this method, it doesn't matter where the injury is on the head, we will be able to control the bleeding. The ambulance dressing I mentioned earlier is often too short and only good for covering up wounds that are on the side or front of the head. So we keep repeating this process of one bandage going around, the other bandage going over the top, until we run out of bandage. At this point we will tie off the bandage and tuck in the ends. It is important that the bandage is kept low at the back to ensure it anchors in place. If you've got a casualty with long shiny hair, if you haven't anchored low, it will slide off. We also want to make sure we haven't covered the ears so we can't affect their hearing, as they could be scared enough as it is from the injury, and we do not want to cover the eyes. Once the dressing's in place and we've checked that it is holding securely, we can be getting the emergency services and getting them off to hospital to have the injury dealt with. So that's one form of bandage that you can apply to a head which gives good pressure and controls the bleeding. We're now going to have a look at a crush injury. Crush injury is when someone gets squashed between two items, whether that's from a car accident, a tree falling on them, or a cupboard. There will be tissue damage at the site of crushing, but also restricted blood flow below the crush site. This can lead to tissues dying off and poisons building below the site of injury. So it's important, when we're dealing with someone who's been crushed, to consider, have they been crushed for more than 15 minutes? If they haven't, you can safely remove them. So lift the object off as long as it's safe for you to lift that object. If it's been more than 15 minutes, you should not release them, but contact the emergency services to get their assistance and inform them that you have someone who's crushed, and then provide plenty of reassurance to the casualty. This is because when you release the object, you could release the poisons into the body and cause the body to go into cardiac arrest. You could also affect the blood pressure as the blood suddenly starts to flow into the areas that were currently crushed. So from a point of view of crush injury, treat the injuries as found, but if it is more than 15 minutes, do not release them. We'll also consider someone who has been impaled. For example, they've gone to climb over railings, got caught and impaled themselves onto the railings, for example through the arm. We treat this as with any embedded object and we do not remove it. We don't know which way it went in, we do not know the damage, and we don't know if it's plugging the blood vessels and stopping excessive bleeding. But if they're dangling from railings, then the key thing is, as long as it's safe for you, to ensure that their body weight can be supported, either put in a box underneath them, a chair, but something that they can stand on just to take the weight, but do not remove them. Again, call in the emergency services, informing them that you have somebody impaled on an item. The other one to consider is amputation. For example, someone accidentally cuts off their finger. In this situation, you need to treat the wound and control the bleeding from the fingers, and then you need to find the part that has been amputated, as long as it's safe to do so. Don't go putting your hand in a machine that could then cut your fingers. Once you've got the part that's been cut off, wrap it in cling film or put it in a plastic bag, then wrap it in gauze or something like a tea towel, and then put it in a bag of ice. Never put the limb straight next to the ice, as this will damage the tissues, hence why we wrap it in gauze or tea towel first. Once it's in bag with ice, label it to the limb of who it belongs to, for example the name of the casualty, the time that the incident happens, the doctors know how long they've got before it's unable to be reattached, and then make sure that when the emergency services arrive, you hand the limb over along with the casualty. So that gives you an overview of some of our severe kinds of injuries that you might end up having to deal with.
So in this session we've taken a look at how you deal with the wound to the hand, a wound to the head, and some special cases like crush injury. So that brings us to a close on our sessions on blood loss. So remember your priorities: pressure and elevation. In the next session we'll be taking a look at burns.